Hello, everyone, and welcome to this afternoon's webinar. Next slide, please. Welcome all to the 7th session of the New Jersey Comprehensive School-Based Mental Health Webinar Series. Again, this is session 7 on funding. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center in collaboration with the New Jersey Department of Education. The Northeast and Caribbean MHTTC is housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy Rivera, and I'm the project coordinator of the center, and I'll be introducing our center and our webinar presenters today. On your screen right now, you will see the dates of our upcoming sessions in this series. Our next webinar is scheduled for Wednesday, May 25th from 3 to 4:15, and our last in session 9 is regarding staff self-care, and that'll be on Thursday, June 9th, again from 3 to 4:15 Eastern Standard Time. Next slide, please. Individual coaching sessions will also be offered to provide more targeted support to New Jersey district level teams. During these 1-hour sessions, we assist teams in developing your comprehensive school mental health framework and provide an action plan to guide your next steps. These sessions will be available to all school and districts on a first come, first served basis and by reservation only. The time slots open for Thursday, May 12th are available. I will enter the registration links in the chat box after I begin introducing. Next slide, please. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. And if you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, we ask that you please sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen, and it's also going to be shared in the chat box. Following this webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future activities. These surveys are also important because our continued funding is linked to the completion of them, so we thank you in advance for your feedback. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint presentation in the next 7 days. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Please do not distribute or reproduce this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. At the time of this presentation, Marian Delphin-Rittman served as Acting Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and we will collect your questions as we go and ask them of the presenter during the Q&A portion toward the end of the presentation. During the webinar, our presenter may post questions to you. So please use the chat feature to answer those questions. Now let's begin our webinar session. We have with us Alex Mays and Dr. Jeff Adams. Alex is the Senior National Program Director at Healthy Schools Campaign and has 15 years of experience working at the intersection of health and education. Her work at Healthy Schools Campaign focuses on policy and program issues at the federal, state, and local levels related to student and staff mental health, health services, and education. Currently, Ms. Mays leads Healthy Schools Campaign's work to increase access to school Health Services and works with states and school districts across the country to expand their school Medicaid programs. Ms. Mays received her Bachelor's in Arts in Neuroscience from Pomona College and her Master's of Health Science from Johns Hopkins Bloomberg School of Public Health. Dr. Jeff Adams has been the Director of Special Services for the Woodbury City Public Schools for nearly the past 20 years. He has a passion for supporting the social, emotional, academic, and health needs of his students and families in the greater Woodbury community, and looks forward to sharing both his success stories as well as challenges he and the district have faced when it comes to mental health in school. Welcome again, everyone, and I will turn it over to Alex.
Great. Thank you so much for that introduction. And it's wonderful to be here and share information about a topic that I'm very passionate about, which is supporting access to school mental health services and programs. And so today's session is really going to dig in around funding for school mental health services and programs. And that's what I want to kick things off with by providing an overview of some of the key funding streams that are available in New Jersey to support work that is happening in school districts to expand access to school mental health services and programs. Next slide. The organization that I work for is called Healthy Schools Campaign. We're a national nonprofit, and all of our work sits at this intersection of health and education. And we work on a whole range of issues that impact health and wellness in schools, from food and fitness to physical activity to environmental health to school health services. But core to our work is really supporting states and school districts in meeting student and staff mental health needs, and specifically looking at how we can support states and school districts in leveraging funding, and particularly sustainable funding, to support the incredibly important work that they're doing. Next slide. So I today want to just spend some time giving an overview of some of these key funding streams that are available to support work that's happening in New Jersey around school mental health services and programs. And the goal of this is really to hopefully highlight funding streams that you might already be aware of and utilizing in your school districts in the work that you're doing to support mental health and wellness of students and staff, but also to potentially highlight some new funding streams and sources that you may be aware of, but might not be aware that can be used to support mental health and wellness in schools. So I'll give an overview of some of the federal, state, and local funding streams that are available in New Jersey, and then spend a little bit of time discussing best practices for guiding funding decisions around how to use those funding streams. Next slide. So to kick things off, I want to spend some time talking about federal funding streams. And I think as a whole, we recognize that there is tremendous need around youth mental health and wellness and the mental health and wellness of staff in school buildings. And increasingly, particularly as we think about responding to the youth mental health crisis, there's significant recognition of the role that schools can play in supporting mental health and wellness. And more we're seeing federal funding streams available to support that work and really recognize that critical role that schools can play. And there's a lot of flexibility around these funding streams, and a lot of these funding streams are already being utilized by school districts in New Jersey, being tapped into. But I want to really underscore where there's flexibilities in some of these funding streams to support mental health and wellness, and where there might be opportunities to increase some of that funding. Next slide. So the first federal funding stream I want to speak about comes through Every Student Succeeds Act. And for anyone not familiar with the Every Student Succeeds Act, it's the nation's K-12 education law, and it sets policy and programs for all K-12 public schools across the country. And this was put into law in 2015 and replaced what was No Child Left Behind, which many people were familiar with, and really represented a paradigm shift in terms of thinking about how we can better support school districts in providing equitable access to services and education that really meet the needs of all students. And with that came a lot of flexibility in terms of how education funding can be used to support the health and wellness in schools. So the primary funding stream available through Every Student Succeeds Act is called Title I, and that's something that probably many of you are familiar with. Title I schools are schools that serve a significant percentage of low-income children, and Title I funding goes to support those school districts in meeting the needs of all children, but really with a focus on how we can support equitable outcomes for low-income children. And there's an incredible amount of flexibility in terms of how Title I funding can be used. And so if your district is receiving this funding, really thinking about how that funding can be used to support school mental health and wellness is an important opportunity, and one that we often see is underutilized. And the law is very clear that this funding can be used to support the mental health and wellness of students and staff. In addition, through the Every Student Succeeds Act, there's funding through Title II, which is for professional development and literacy. And particularly on the professional development front, again, there's a lot of flexibility in being able to use this funding to provide training to school staff around student mental health and wellness. So that could include providing training around how to connect students to appropriate mental health supports and resources in the community. It could include providing training around best practices for social and emotional learning and integrating that within classroom practice, as well as a whole host of other things, including staff mental health and wellness as well. And then finally, through this federal education law is what we call Title IV, which is designated funding for health and wellness in schools. And that primarily comes in through the Student Support and Academic Enrichment Grant Program, as well as through funding for community schools. And particularly for the Student Support and Academic Enrichment Grant Programs, this is designated funding for health and wellness in school districts in New Jersey that is coming in. And it's the case for all schools, it's many school districts across the country, but it really, again, presents a really critical opportunity for supporting student and staff mental health and wellness. And so I share this to really think about, if you are within a district, it's well worth understanding how your district is accessing these various funding streams through the Every Student Succeeds Act, understanding how they're being utilized, and particularly for Title IV, which is that designated funding for health and wellness, looking at where there might be opportunities to leverage that funding to support mental health and wellness in schools. Next slide. So next, I want to speak about Medicaid. And this is something that I think is very worth paying attention to, because this is where there's opportunity to potentially strengthen work that's happening in your school district, and ultimately bring in additional sustainable federal dollars to support mental health and wellness within districts across New Jersey. So the primary way that school districts in New Jersey receive Medicaid funding, and Medicaid is the nation's public health insurance program, and make sure that for low-income individuals, that they have affordable health care coverage. And so in New Jersey, school districts are able to access Medicaid funding through what's called the Special Education Medicaid Initiative, or SEMI. And that specifically provides reimbursement to school districts for eligible services that are included in students' individualized education programs. So services such as individual counseling or therapy, various assessments, school nursing services, any eligible service that is included in that student's individualized education program, a school district, if that student is enrolled in Medicaid, the district can be claiming for those services. It presents a really important opportunity to think about, how to strengthen work that you're already doing within your district around Medicaid claiming, or if your district isn't participating in SEMI, to think about participating, because this is federal dollars that come in to school districts and can really be utilized to support mental health and wellness in the schools. Next slide. And just to be specific about what this means in terms of the eligible services and providers in New Jersey, this is a chart that just highlights when we talk about school districts billing Medicaid in New Jersey for school mental health services, the eligible services under the program are assessment services and then therapy services, including individual, group, and family therapy services. And again, those services need to be included in a student's individualized education program. So services that are delivered on more of an ad hoc basis, like crisis intervention services, are not going to be Medicaid eligible, but it can present a really important opportunity for bringing in reimbursement for a lot of the work that districts might be doing to meet the mental health needs of students with IEPs. And the providers that are recognized as being Medicaid eligible under New Jersey's program are listed on the right and include licensed psychologists and social workers, as well as school certified psychologists and social workers. And so in addition to school districts accessing Medicaid funding through the SEMI program, there's also a lot of work in New Jersey happening through partnerships with community-based providers, and where a district may be partnering with a community mental health provider, with a community-based clinic, with other providers that are in turn delivering services either in the school building or or in partnership with that school. And those providers that are located in the community very well may be billing Medicaid as well and are able to bill Medicaid. And so that, I think, is a really critical talking point, which I'll underscore again later on in my presentation, that as districts are thinking about forming partnerships with community-based providers to deliver mental health services and meet student mental health needs, emphasizing that those providers can bill Medicaid for eligible services can be a really important point to acknowledge that not all providers necessarily understand, and really presents it as a win-win opportunity that districts can receive the services that their students need, and in turn, those community-based providers can draw down Medicaid funding to support their time and work. Next slide. Another key way in New Jersey that presents funding for mental health and wellness work in schools is through the Individuals with Disabilities in Education Act, which provides federal funding for the education of children with disabilities. New Jersey receives a significant amount of funding through IDEA funding. It's on par with the Title I funding through the Every Student Succeeds Act. And again, this funding can be used to support the delivery of mental health services that are included in a student's individualized education program. So your special education services, and it can be used to really be done in partnership. If your district is participating in the state's Medicaid program, this can be a really good way to complement the work that is happening through Medicaid claiming. But that IDEA funding can be a really key stream for ensuring that students with disabilities that also have mental health needs that are included in their IEPs are met. Next slide. And then I just wanted to spend a little bit about time on COVID relief funding, which is a one-time opportunity, but I think is very much worth underscoring within the context of this conversation, because it presents a really historic opportunity for supporting mental health and wellness in schools in New Jersey. And so New Jersey has received over $4 billion in federal COVID relief funding to K-12 schools over the last 2 years. And the most significant amount of funding came through the American Rescue Plan, which was passed about a year ago. And school districts have until September of 2024 to determine how they're going to be spending those funds. But there's a lot of flexibility in terms of how these COVID relief funds can be used to support mental health and wellness in schools. And the U.S. Department of Education, which is supporting states and school districts in utilizing these funds, has been very clear that school districts can and should think about using this funding to support student mental health and wellness. And really recognizing that, so many students and staff were impacted by mental health and wellness issues prior to the pandemic, and that the pandemic has only exacerbated those issues, and that utilizing these funds to meet those student and staff mental health needs is an excellent use of these funds. There are a number of ways in which these funds can be used to support mental health and wellness within schools. Some of those that we highlight frequently include using the funds to hire school mental health providers, hiring district level staff to support mental health and wellness across the school district, and then really building district capacity, including investing in data systems, training technology, and other systems that can really support the delivery of mental health services and programs in the long run. And I will just say, as we engage with school districts around this work, we really try to underscore the importance of thinking about how to use these funds in ways that do build districts' capacity to support this work in the long run. We recognize that there's tremendous need right now, and certainly using the funds to hire school mental health providers, to invest in immediate COVID-19 relief needs are very much an important use of the funds. But I think it's a really historic opportunity to also think about how these flexible funds can be used to support your work in the long run and position school districts to draw down funding after this COVID relief funding has run out, to ensure that they can continue to deliver mental health services and programs in the long run. And so that's really where hiring district level staff, building district capacity through investments in training and technology and whatnot can just be a really fantastic use of these funds to support mental health and wellness in your district in the long run. Next slide. So next, I just want to speak to state and local aid and highlight some of the opportunities within New Jersey around these funding streams. So state and local aid are the primary funding sources for New Jersey state public schools, and the majority of New Jersey state public schools receive their funding from their annual school budgets through local property tax levy on a per pupil basis. And the state and local funding can be used to support school mental health, and it's really at the discretion of school district leadership in terms of how these funds are invested. But again, presents a really important opportunity to support school mental health and wellness in New Jersey. Next slide. In addition, the state does have some designated funding within the state budget for school mental health. In the New Jersey state budget, there's funding that's appropriated to the Office of School Link Services, which is housed within the Department of Children and Families. And through that Office of School Link Services, there's a number of funding opportunities that go out to school districts to support mental health and wellness, including mental health counseling, employment counseling, substance use prevention, and a host of other mental health and behavioral health related initiatives. So it's well worth paying attention to funding opportunities that may be available through that agency and really engaging to look at how the funding for that agency is being provided to support work that is happening at the district level. Next slide. And then another unique opportunity within New Jersey is through the state's Extraordinary Aid Program, or Ex-Aid, and Ex-Aid is a provision in New Jersey's funding law that provides supplemental state aid to school districts for each student who needs intensive services and has special education costs that exceed a certain threshold. And so for in-district public or private placement where a student is being educated alongside their non-disabled peers, New Jersey will cover 90% of the total cost of providing direct instructional and support services in excess of $45,000. And then for specialized public school programs, the state will pay 75% of the cost in excess of $45,000. And finally, the state will pay 75% of excess costs above $55,000 for students that are placed in private schools for students with disabilities. And ultimately, the District of Residence is responsible for providing the excess funding for students with high-cost disabilities. And Ex-Aid can really be used to support the delivery of intensive school mental health services and supports that are required in the student's IEP. But I wanted to underscore this because when possible, this is another opportunity that keeping a student in district schools and educating the student alongside their peers when possible can really maximize the state's Ex-Aid funding for the school district to ensure that they are receiving that 90% reimbursement above the $45,000 spent. So just as thinking about ways to really maximize that state funding, there's an advantage when possible to keeping the student in district and educating them alongside their peers. Next slide. And then finally, I just want to underscore that at the local level, something that we see a lot in New Jersey is partnerships with local community organizations, with private foundations, hospitals, community healthcare providers, and other community-based entities to support mental health and wellness in schools. And this can just be a tremendous source of funding, of in-kind resources to support mental health and wellness within schools, and can often be a win-win in terms of helping these community-based entities meet their goals while also bringing in resources to districts to support the work that they're doing to meet student and staff mental health needs. Next slide. And so finally, I just want to highlight some of the best practices that we see for kind of untangling all of this. I know this is a lot of information. There's a lot of funding streams to track, especially at the federal level. But I think a key point we emphasize in all of this work is the importance of recognizing that it doesn't need to be one single funding stream supporting a program or provider type or work that's happening within a school district, that there's tremendous value in looking at how various funding streams can be integrated, and the term we use is braided and blended, and really woven together in a way that can support access to these school mental health services and programs. So looking at those federal streams and seeing where you have a student or that is Medicaid eligible and being able to bill Medicaid for those services, but then also looking at where state funding can be used to fill in the holes, or where in the short term COVID relief funding might be able to cover salaries of some staff or programs that you're doing to meet student and staff mental health needs. So just really underscoring the value of looking at how these different funding streams can be integrated to fully fund these programs and services. And then we really underscore the importance of teaming and recognizing that there are a lot of players that can be involved in navigating all these different funding streams and making decisions around how to invest these funds, from district leadership to school health and wellness staff, to community, student and family members. There's tremendous value in terms of engaging a broad range of stakeholders to really inform decision-making around funding. And then finally, really doing this work with a focus on diversity, equity, inclusion, and thinking about how, as you're making these funding decisions, these funds can be invested in ways that really support equitable access to services and programs, and meet the needs of all students, but particularly those that are disproportionately impacted by student mental health and wellness needs. And that's where looking at your data can be incredibly helpful to understand where needs are, engaging community members, students, and families to really hear from them what the needs are, and where they want to see more support from their schools, as well as strategies such as making sure all materials that you're producing are translated and available in multiple languages for members of your community. Next slide, I think, is just my reflection question. So just, again, recognizing this is a lot of information, we really encourage districts and partners to think through, look at the mental health supports that are available within their community, really understand the assets that are already in place and what funding is already available, and then really thinking through where there might be funding streams that can be layered on top of existing work to meet unmet needs and support the delivery of more services and programs. And then really looking at prioritizing what immediate needs are and starting there, instead of recognizing that we can start with those immediate needs, look at funding that can be utilized to address those and build from there. So I think the last slide is just my contact information, and happy to take any questions about the information, and look forward to hearing more about the work that our next presenter is doing in his school district. So I think, Jeff, I will hand it over to you next.
All right. Hello. So thank you for giving me the opportunity to just share about the successes, but also the struggles that we've been through at Woodbury. Definitely, we've learned a lot over the years, some mistakes, but also learn ways to be successful. So hopefully we can share what we've done over the last, really, for me, 15 to 20 years here in Woodbury to kind of tackle mental health and go over that with you guys. So as far as Woodbury, for those of you that don't know, we are a small district, a small city, if you will. And I jokingly say the word city, but we actually are deemed a city in the the nomenclature, a city that is a whopping 2.2 square miles. The neat thing, though, about Woodbury is we truly are a microcosm of society. About a third of our population is Caucasian, about a third African American, and about a third Hispanic. So it really is a nice blend of folks. About 70% of our students do receive free and reduced lunch. So we are a low income district. We are a Title I district. And when we talk about the evolution of a district and kind of having to evolve services, whether they're academic services or social and emotional services, when I started 20 years ago, probably about 2% of our population was Spanish speaking primarily, or ELL students. And today, again, 15, 20 years later, we're probably closer to about 22 to 25% of the district now English is their second language. So that's been a challenge when it comes to academic instruction, but also with how to provide mental health services culturally to communities that kind of historically don't take advantage of social services, and then trying to provide that in a native language. So that's the background of the district. So next slide, please. All right. So interestingly, this seminar is all about funding, right? We heard a lot of different funding sources, in the prior presentation, and I live every one of them. The ESSA funding, Title I, IDEA, Medicaid. That's me every day. Knew exactly what was being discussed, and again, we've had to maneuver those, and we've figured out ways to maximize those income streams. However, what does this first slide talk about? It's talking about climate and culture first. Because again, although the focus of this specific strand of webinar is funding, if you do not have a climate and culture first, you're wasting time. And what I mean by that, kind of an analogy I'll say, it's kind of like you can go to the store and buy the best piece of filet mignon, right? And spend $16.99 a pound, an extraordinary amount of money. And if you take that filet mignon and you put it in the microwave, it's not going to come out good, right? But if you put it in that right environment, that smoky grill, with the right seasonings, that same piece of filet mignon that costs the same amount of money, it's going to be an amazing dinner. So for us at Woodbury, we use this concept called Keep Love Present as kind of our underlying philosophy, our underlying climate and culture. It was a consultation from a company out of Camden that kind of brought this to us. And again, I'm not advocating specifically for the Keep Love Present model. There's many other models out there of kind of a nurtured heart approach is another one. There's several, if you just Google, culture and climate kind of programs, but for us, the key was for every staff member in the district to really have a passion for the hearts of students, to have a vision that we're not just here as educators to teach reading, writing, and arithmetic, but that also social and emotional, mental health, and even the physical health needs of our students is just as important. Beyond that, the health and wellness of our teachers is just as important. I don't know who's on this webinar, but if there's any folks on here that are therapists that know about, the old Freudian terms of countertransference or transference that happen in a therapeutic relationship, I liken that to the administrator to teacher, teacher to student relationship. And what I mean by that is that, again, when we talk climate and culture as a school administrators, if we're leading with love towards our staff, and that doesn't mean we don't hold them accountable. We have to hold, kids are held accountable, staff's held accountable, right? But when we're leading with love for our staff, meaning we're treating with respect, we're treating with professionalism, little things, it's staff member's son or daughter has a play at 2:30 one day and they want to take a half day to be able to catch it and go see it. It's like, no, leave it 2:30. I'll cover your last 30 minutes of class. I got you, Little things like that. When we show our staff love and compassion and we recognize the work that they do, they're going to lead with their students with that same love. when that child's having a rough morning, when that child didn't turn in a homework, instead of leading with an authoritarian mindset, they're going to lead with love, because we demonstrated that love to the staff as administrators. So I do believe there's, again, call it a counter transfers, call it a parallel process. Starts at the top of the administration and vision. You work it down by treating your staff that way. You create a vision and a culture. Again, for us, Keep Love President Woodbury, an amazing model. It really has transformed kind of the climate and culture. And now we've primed the pump. Now we're ready to say, as a district, Woodbury is about more than just academics. It's about the whole child. So now when that Title I funding comes in, now when that ESSER funding comes in, that Medicaid funding comes in, people feel good if we spend the money on mental health. They don't, you don't have the teacher saying, great, they spend it on another counselor. Well, we could have used that on reading instruction, right? For those of you that work in the school system, I'm sure you can relate to that. But again, that's step one. Before you even worry about buying that filet mignon, get your grill set up, get your climate and culture in check. And that, in Woodbury, that was years. That was 2, 3, 4 years till we really came to that understanding. So slow and steady wins the race, climate and culture. All right, next slide. So this, when I did this presentation, honestly, initially for our Board of Education, kind of to show them why we were spending some of the money. Again, that's another component of this. You know, the administrative team's on board, the teachers are on board, but you need your Board of Education. It's really your governing body that really at the end of the day are going to authorize or not authorize your bottom line budget. So I did this for them to show them that, you know, statistics show, national data shows, like, mental health is critical. It directly impacts our students, especially now with, you know, as we've heard, coming off of COVID and, you know, nearly 18 months of non-traditional school, of remote learning, of hybrid learning. You know, we're seeing this year back now full days. The kids are struggling a little bit more so than usual. So again, prior to COVID, even this data is going back to 2017, 18. Again, I was presenting to the board, just showing them kind of the need for this. You know, 1 in 5 children and youth have a diagnosable emotional, mental health or behavioral disorder. I mean, think about that, 1 in 5. Like that's a big deal. If you're a classroom teacher, then average size 20, you know, kids in a classroom, and that's for some districts probably low. You're talking 4 students in that class are going to have some sort of social, emotional, mental health issue. That's a big deal. 1 in 10 young people have a mental health challenge that's severe enough to impact how they function in the homeschool or community. So what does that functioning look like? Is that meaning it's impacting them to the point of crossing the threshold of a 504 plan or special education services? Is that causing them in the community to be adjudicated or to have probation issues or legal issues? You know, how is that manifesting to a threshold of 1 out of every 10 crossing that line? On average, 50 to 80% of children do not have access to receive the mental health care that they need. Remember, a lot of these kids that have these social and emotional issues, you know, they're in elementary school. They don't have the authority, even if they wanted to get services, to seek counseling on their own. They're reliant on the adults to do it for them, whether that's a caretaker, whether that's an agency like DCP&P, or whether that's the school district. Okay, nationally, only 40% of students with emotional behavioral mental health disorders graduate from high school, compared to 76%. So again, as school districts, right, our primary purpose, you know, going back to the 50s, reading, writing, and arithmetic, we get it. But look, here it is right here in black and white. Only 40% of kids that have a social and emotional order graduate, compared to 76% of students that don't. So it's directly, it's intertwined. You cannot separate the academic growth from the social and emotional mental health well-being of children. I mean, I'm not making this up. This is, you know, coming from the Center for Child and Adolescent Health, you know. One piece of data, over 50% of students with emotional and behavioral disabilities at age 14 drop out of high school. Again, that's the highest dropout rate of any disabilities group. So again, what is the need? Keep that slide, like seriously, like when you know, if you're a teacher, if you're a counselor, if you're an administrator, keep this slide when you go to your superintendent, when you go to a budget meeting. They say, well, Jeff, why do we need this? This is fluffy. We don't need another counselor. Show them that. Show them this data right here. I did the work for you. Next slide. Okay. what does the research say about mental health school-based services? So again, this is kind of the flip side of that. This is just showing how the positive, right? So if you want to look at it, you know, I think a lot of things in life I look at, it's two sides of a coin, it's yin and yang. So the last slide was the bad news slide, right? Well, this is the good news slide. You know, I'm not going to read it in word for it, but it basically shows you, it says in that slide, again, this is coming from a mental health school-based source here, that when you create community partnerships, when you build capacity for mental health services in schools, that negative data that we talked about on the last slide can significantly change to positive growth for students, for positive academic growth, and for positive community growth. All right, next slide. So as a district, we had this vision for, you know, mental health services, social and emotional being important, right? So we had built that, and when we were building it, when we were really getting everyone on board, you know, we had some changeovers in administration on the superintendent front. Mr. Bell, our current superintendent, has now been here. He's going on, I think, his third full year. You know, and he's fully all in now with kind of helping create and drive this model of social and emotional health partnerships in the school. But prior to that, again, multiple superintendents since I've been here. We've had, I think, like 4 superintendents. We had like 3 or 4 years of interim superintendents. Again, that's a key, having that leadership at the top. I was fortunate that I had one superintendent for like 10 years. So I didn't realize how much having that consistent leadership meant until we had like 5 years, I think it was, of 3 interims and not having that constant rudder. And now, thank goodness, having Mr. Bell back to kind of give us that consistency. So when we were going through that transition, when we were kind of building up to this, we had, you know, partnerships. We were starting with Robin's Nest, which is now in Senda. We had a social worker provide, you know, some pilot programs of a counseling program. We tried to redistribute one of our district social workers that was bilingual to be up at the high school, because we found that a lot of our senior high school students, kids, right, they were 15, 16, 17 years old, that had migrated from the South, from Mexico, from Guatemala. They had been through some major trauma. You know, some of the things that we see on the news about what happens to these kids when they're trying to come over, you know, into the country, you know, just terrible traumas. You know, these weren't news stories for our kids. These were things they experienced. And, you know, we were wondering why they were struggling in school on top of the language barrier. Again, they had just gone through significantly traumatic experiences. Several students that I don't even want to kind of say what they were, but you guys can figure it out. So again, redistributing my elementary school social worker who was bilingual, putting her up at the high school so she can provide some mental health services to those kids, creating mentoring programs on a small piecemeal trial basis. And then one of our initial pilots was psychiatric services. So we're going to dig more into it later in the presentation, but here at Woodbury, we literally have a psychiatrist once a month come into the district and write scripts for students, so that kids that can't access medication can walk out with their parent with a script that they just have to take to the pharmacy. And as long as they have, you know, baseline New Jersey, you know, Medicaid, some sort of insurance to fill that script, they can get mental health medication. So that's been a huge thing that we're going to talk more about. All right, next slide. So one of the things we learned about when we talk about social and emotional health of the kids is expanding the school day. You know, 8 to 3 is critical, and we're going to talk about, you know, what we did there, but extending the school day. And I think most districts have ways to do that, you know, either in their local budget, or I know a lot of districts do use their Title I funding for after school programs. But at Woodbury, because we were creative, because we were aggressive, because we did research and we took the time to take a shot, we have 3rd through 8th grade after school program that doesn't cost the district any money out of our local budget. When I say local budget, that includes not our ESSER funding, not our Title I funding, not our Medicaid, nothing. We have the 21st Century Program Grant, which is a federal grant that basically is a program that runs 5 days a week from 3 o'clock to 5:45, where kids are getting after school homework help. They're getting different little mini clubs, Lego club, sports club, skateboarding club, film and video club. And then they're also even getting a healthy dinner. We serve them dinner on site. At the elementary, 3rd through 5th, we have what's called our Blues Brothers and our Gals program. One is predominantly for our male students, one for our female students, as you can probably figure out by the names. And that's funded through our Youth Service Commission, local to Gloucester County. Again, the 21st Century program and the Youth Service Commission program, they were competitive grants. We had to have ideas. We had to have the ability to write it in a grant application, and we were fortunate that we were given those grants. I do firmly believe that there is more money like that out there than people realize, and that you just have to do the work. While I was sitting here listening to the other presentation, I had my email up. I got an email from the NJ New Jersey Department of Juvenile Justice Commission, because I'm on one of their mailing lists. They were just promoting a new grant that they have for at-risk kids, a prevention program. So money is out there, from private companies and from the federal and state government if you look for it. And we don't have a grant writer. There's no grant writer at Woodbury. We have 12 administrators in the entire district. For the Youth Service Commission grant, I had a passion for this. I partnered with my school resource officer literally like 9 years ago, and we wrote it and we got it, and we keep renewing it every year since. 21st Century, I believe it was actually our curriculum director that just had a passion for trying to bring after school program into the 6th through 12th grade. And she worked with the guidance department. They wrote the grant and they got it. So, like anything in life, there's no magic bullet except sometimes just rolling up your sleeves and doing the work, taking a chance and doing the work yourself. All right, next slide. All right, so as we started to kind of move through the after school programs, we started to kind of move through there's other kind of bulleted programs we talked about, whether we're kind of what I'm going to call piecemeal, right? We had a sender coming in to do a little bit of counseling. We moved the social worker around that was bilingual. We were noticing that there's kind of 3 converging trends, right? You've got more students not accessing mental health services that need it. You've got, like we saw, evidence-based interventions do work if accessed, and we're seeing an increase in students that need support, right? So now it's like everything's coming together. Like, well, what are we going to do now? What's the next step? Next slide. All right, so based on kind of all of the things that we talked about before, and kind of our connection with kind of being able to reach out to, whether it was different grant programs, just kind of getting to know the community through those things. I think right now our biggest highlight, our Woodbury City Public Schools, version 2.0, if you will, it's this partnership with the Youth Advocate Program. And the beautiful thing about this partnership is it is providing actual mental health services for our students in our buildings during the school day. And wait for it, it's not costing the district, it's not costing the families 1 penny. So I'm talking, again, this isn't tapping any of those funding streams that we talked about earlier in the prior presentation. It's not touching our local budget, and it's not costing the parents anything. Yet we're getting, I think right now, and we talked about the size of the district, not a huge district, right? So right now through our YAP program, we have 3 counselors working, 1 in one elementary school, 1 split between another, and 1 up at the junior senior high school. So all of our buildings are covered. So 3 mental health counselors. I think we're servicing about 70 or 80 students right now, costing us nothing. So what does that look like? And don't worry, I'm going to tell you the secret sauce of how it's happening on the next slide. We're going to get there. It's going to tease you guys a little bit. All right. So next slide. So access for our students. So what is this YAP partnership, right? So basically, and remember, the table has been set. The climate and culture has been built. So the staff wants kids to get services. There's full buy-in here. So here's what happens. YAP counselors come in and they have a designated office space in the building, right? And I'll be honest, when you talk about barriers, probably one of, if not the most time-consuming pieces of getting this YAP program up and running was having to work with the Department of Licensing and Inspection and have the state come out with the YAP counselors and L&I to inspect the office space in each building to look for our, believe it or not, even though we're a school with kids in it every day, our certificate of occupancy, when our last fire inspection was, a log of our school safety drills, because what they actually did was they satellite licensed specific rooms in each building in our district to be youth advocacy program offices, right? So when they're in those offices, technically they're not in the Woodbury City Public Schools. They are in a satellite office of the youth advocacy program. So again, their counselors are coming here. They're providing direct one-on-one services. They're providing small group services. They're providing consultation for teachers, training for teachers as needed. So how does this happen? So why does this happen, right? It's actually a super win-win. It's a win for us as a district, a win for the parents and the community and the kids, but it's actually a win for YAP. And here's why. Not sure again who I'm talking to as my target audience here, but if there's any community-based mental health counselors right now, because I actually was for a number of years in the evenings, I would go and I would go to my agency where I work from 4 to 7 at night, and I would have, 5 sessions booked from 4 to 7, and I'd be lucky if 2 out of 5 of those clients showed up. And when 2 out of 5 of them showed up, guess what I got paid for? 2 out of 5. The other hour and a half I was sitting there, could have been home with my family, but unless I had a client to bill for, that's what it was. So now I'm therapist A from YAP and I get assigned to Woodbury. So from 8 to 3, I'm in this school in Woodbury. Well, why is that good for me as a therapist? Because if there's 8 sessions billed back to back to back or booked back to back to back to back to back, those 8 kids are in school. Once consent's given and demographic information is taken and intake is done, I now know as that therapist, when I walk into Woodbury, unless one of my kids is absent from school, I'm going 8 for 8. I'm going to be able to bill for every hour I'm there. So who's getting billed, right? We're talking about billing. Well, somehow someone has to make money. So the reason this works in Woodbury, and again, this specific approach might work for some of your districts. It might not. It works for Woodbury because, like I said, when I introduced our district, 70% of our school is on free or reduced lunch, which means about 70% of our students qualify for Medicaid. Well, the youth advocacy program is a Medicaid provider. As a result, what happens is when they come into the building, we screen the parents, we know who's Medicaid eligible, and then they're billing Medicaid directly. So whatever that Medicaid reimbursement rate is directly, it's going from Medicaid to YAP. We're completely out of it. So what I've done is I've hired and you can move to the next slide because I'm kind of blending slides here. And you can actually kind of cover that, even hit the next one as well. So so this shows you here when we get to the agency responsibility. So there you go. They're doing all the billing. It's, through Medicaid or private insurance. But again, mostly Medicaid. And they're doing, tracking progress notes, treatment plans, everything. So again, really think of this as, if you're working in a school, and again, my social workers, my counselors, even my special ed teachers that might be on this call, I'm sure you can relate to the idea of trying to get mom and dad for one of your students to call that community mental health agency and to drive 10 miles, 6 o'clock at night to that appointment. We've just wiped that barrier away. We've made a virtual office right in the building, and at 10 a.m. the kid can pop out of their whatever class and have a 40-minute session right then and there. All right, next slide. And again, that is funded fully through Medicaid, which again, the majority of our students are eligible for. We do have a portion of the budget. Here's where now we did tap, I think it was our ESSER funds, to hold some money so that if there is a student that we feel would benefit from this program, but their parents are above that threshold and do not qualify for Medicaid, we have a sliding fee arrangement with YAP where the district will cover, some of those costs. So I think where we are right now, I don't believe we've had any students that we've had to turn away from the program due to them not having Medicaid, because again, we've allotted a portion of money from some of those fundings sources we learned about earlier today to cover those kids. And then the only cost of the district is, again, trying to create that even enhanced program, because again, I think that when you talk about outpatient community mental health, it does sometimes operate on a silo where they're not, those parents are getting that service 6 o'clock at night. Great for the kids, but there's not a lot of carryover into the school. So we have one district social worker that kind of serves as what I conceptualize as the case manager for those 60, 70 kids that are getting the service, right? So her role is to communicate with the families if there's anything they need in the community beyond just the therapy, to kind of be a bridge between the counseling session and the teacher. So she might have, grade level team meetings where she's just kind of hitting on some key goals for each student, maybe bringing back to the therapist reports of how the kid's doing in school. So we try to kind of create a bridge so that that therapist isn't on a silo, and that district social worker's role to kind of be this pseudo case manager, pseudo school-based liaison bridge between the agency, the family, and the teachers. All right. Next slide. All right, provision of psychiatric services. So I hit on this. This was something that we were doing 1 day a week before. I'm sorry, 1 day a month before, rather. We've now increased that to 2 days a month with some of those ESSER fundings and COVID relief fundings that we heard about earlier. So this is a big deal. And it's a lot of money, but in my opinion, it's a huge overall net savings. So we heard before when we were talking about extraordinary aid funding about the concept of trying to keep kids in district, keep costs down, have kids in the least restrictive setting whenever possible. But let's be honest, sometimes the mental health issues, the psychiatric issues are such that the child can't function in district and they do need a specialized program. However, if that child's able to access mental health counseling coupled with psychiatric services, actual medication management, they might be able to function in school. And we have countless examples here in Woodbury of kids that once we have the medication and the counseling in place, they're different human beings, they're different children, they're able to function, they're able to have the skills they need and from the counseling, and they're able to have their neurochemistry taken care of through the psychiatrist. So we have a psychiatrist that is here 2 days a month. It's a lot of money. We're talking for 2 days a month, 12 months a year, because we want the kids to have their medication in over the summer. We're talking 40 grand. So that's a lot of money. I'll let that sink in. And that's coming from the local budget. However, right now, I believe we have about 25 to 30 students receiving medication from our consulting psychiatrist. I know, because I know those kids, because I schedule their meetings and I know how they're doing. I keep track of them. I would say at least 5 of those students are students with IEPs that at one point or another prior to the medication intervention coupled with the counseling were on track to go out of district. So if we take a lowball number, and trust me, it's a lot higher than this, we're going to be conservative, a lowball number of 30 grand for one out of district placement, 5 grand for transportation, that's 35 grand. And we're talking, in my belief, which I'm pretty sure is conservative, probably 5 of those kids right now getting medication would have had to have been placed out of district without these interventions. That's about $160,000. And what did we say? Right now, our psych services are costing around 40. So not only is it saving the district potentially over $100,000, there's still another 20 plus kids that maybe were at a different threshold of functioning that didn't need to go out of district, but they're getting a service that they couldn't access because, again, not sure who my target audience is here, but if anyone is trying to get psychiatric services, medication for children right now, you're on a 2, 4, 6 month waiting list if you're lucky. That's if psychiatrists are even taking on new clients right now. And again, why would a psychiatrist want to partner with a school district like this? Because if you're booking them 8 clients in a row that are going to show up because they're in the district and they're not having holes in their schedule, it's a win for them, just like it is for us. So when I went to increase our services from one day a month to 2 days a month, our psychiatric partner was like, absolutely no problem, would love to do it. So again, that's, I feel, a pretty creative, innovative solution. And it's one now that I think it's really paying off huge dividends for us. All right, next slide. All right, successes. As we talked about, it's the climate and culture. I talk about this climate and culture of loving on families and students. All the time. Collaboration. The idea of mental health cannot be an idea that this is a siloed operation that a counselor comes into a district and does. If you have that mentality, again, you're going to throw all that money on that filet mignon and you're putting it in the microwave. And I thought of that analogy last night. I know it's silly and goofy, but it's going to stick. You're going to be in a budget meeting and someone's going to be talking about, oh, we can buy this, we can buy this. And that light bulb's going to go on. Well, that's great. We're buying this filet mignon, but we're just sticking it in the microwave. What's the point? We might as well just bought hamburger. Unless you have a collaborative mindset, unless you have a table set for a climate and culture of people really in the district feeling like the mental health needs of the students, loving on students, social and emotional growth of students is right here on parity with reading, writing, and math. You're just microwaving the filet. Extending the school day. Again, that's huge. Extending the school day. Again, a lot of our students don't feel that traditional sports and activities are something that they're interested in. So after school programs that have some other hook to them, whether it's, art or music or the Lego club. Again, we have in our 21st of the junior high this year, we have an esports. We're a registered esports team. I think the esports kids actually had their first win against another district in I don't know, somewhere at crazy. It was in Wyoming or something. They were virtually playing these kids. So it's pretty cool. And then, as we already mentioned and raved about, those psychiatric services in the buildings, again, at zero cost to families to remove those barriers. All right, lesson learned. Already said it once, say it twice, I'll say it 5 times. They hit this point home. Simply placing mental health providers in the building is half the story. The filet mignon can't be cooked in the microwave, folks. We want to make sure we are loving on it with seasoning and spices and in a nice fancy grill. Cultivate that culture first before you worry about spending money. Start slow, start small. Again, we're servicing all these kids in Woodbury. It didn't start like this, though. It started as a small piece, a small pilot, and we grew it organically. And build those relationships. Build those relationships. We heard about it in the last presentation. You're going to hear about it now. Build relationships. They're out there. Find competitive grants. About 15 years ago, I reached out to Verizon randomly and said, hey, we want to do a new reading program here in Woodbury. I wrote a 2-page little write-up to, a grant piece of Verizon. They gave me $10,000. Many of these big corporations, Microsoft, Google, they're dying to give money to schools so they can say they're giving back and doing good. You have to put in work. And look, I know we're all busy. I know we all do 75,000 things, but at the end of the day, do 75,001 things, because if you get that grant, if you get those mental health services, if you get the ability to meet the social and emotional needs of your students, it's going to take off other things off your plate, because you're not going to be running around with discipline problems or behavior problems or teachers feeling burned out, because there's going to be a collaborative culture of support and everyone's going to be working in the same direction, rowing the boat in unison, lowering the burden off of each individual. So with that, I think that's all I have. I think at this point, we're going to turn it over to questions and answers, I believe.
Yeah, so thank you, Jeff and Alex, both of you, for your wonderful presentations. So we do have a couple of questions for the next few minutes that we have allotted. And so we'll just kind of jump right into them, and whoever kind of feels like they would like to answer this one. We have, sustainability is always at the forefront of my mind. With the time-limited nature of grant funding, do you have some suggestions for how to sustain programming, especially when it comes to funding for direct service providers like counselors?
Well, yeah. So again, like I was kind of saying, for a lot of the services, the big one, the app service, that there's no funding involved. So it's finding creative community partnerships. So for Woodbury, that worked because we have such a high level of students that qualify for Medicaid. And again, just about any outpatient mental health agency, in the state's going to take Medicaid. So if you are a low income district, I would go right for that because you will not be impacted by grant funding at all. The other piece is if you are using grant funding, yes, they can run out. We know that. So you get to a place where strategically you fund it through a grant, and if you see it's growing dividends, you slowly migrate it to the local budget, right? So again, I'm not a master at this because I'm not the BA, but in working with our BA, I know that okay, so if X is all through the grant this year, well, X minus 50% will be next year and X minus 75% the next year, so that if we know that grant funding is a limited 3, 5, whatever term limit, you've built that into it so that you've transitioned from the local budget to the grant. And that is what we did for the psychiatric services. At one point, our psychiatric services were through the IDEA grant that you heard Alex talk about earlier, right? And then we moved it from IDEA to the local budget. So that would be my answer to that question.
Yeah, and I would just hear to everything Jeff said. I think partnerships, Medicaid, and I love the example Jeff gave of the extraordinary aid. I think really collecting where possible, collecting the data to make the case that ultimately a lot of these mental health providers can result in cost savings in one way or the other, and to really make that case for them, hopefully having them moved on to the state or local funding is a key strategy as well.
Wonderful, thank you. So our next question is about grant writing. We've talked a lot about grants, and the question is, all of these potential sources of funding sound really exciting, but grant writing can be intimidating and time consuming. And we just don't have the support staff to do so. Are you aware of any specific resources to help with grant writings for schools?
Honestly, there's millions of places. You just got to Google it. There's people dying to write grants for you to then take 10% of the cut from you. Honestly, I think it's a waste. No one has time, but again, you make time for what's important for you. I didn't have time to write a grant for Verizon. I didn't have time to write a grant for Youth Service Commission, but we made it happen. And the best advice I can give you, in grad school, we had a grant writing class, and it was so simple, what the professor taught us. And I think that's what kind of led to some of our successes here in Woodbury is answer the questions. Most grants are very specific. It's like bullet point questions where this question is worth 10 points. This question is worth 5 points, and restate the question in your answer. So if they're saying, well, what is the demographic population of Woodbury? Literally grammar 101, right back so right on that. The demographic population of Woodbury is da-da-da. Next question. How are you going to meet the needs of the students' mental health needs in Woodbury? We are going to meet the mental health needs. Seriously, restating the question in your answer. Simplistic. Don't overthink it. You're all professionals. You are an educator that went to college, possibly went to grad school, wrote papers, I'm sure. Just dig in and do it. Take the leap. I assure you, it's not as competitive as people think, because most people think like the person that asked that question. Well, how am I going to do it? I'm just an administrator. I'm just a teacher. I'm just a counselor. No, you are a teacher. You are a counselor. You are an administrator. You can do it. Take the leap and do it.
And I would agree. I think it's definitely, the juice is worth the squeeze if you can take that leap and do it. I think also, there's, in moving along with the thread of community partnerships, there are so many community-based organizations that do have grant writers on staff and are often dying to partner with school districts to do work in this space. And so that's another strategy. Again, it results in having to share some of that funding, but could also open up opportunities for funding that your district might not be aware of. And so I think, engaging with community-based organizations that are doing work in the space that you're interested in getting funding for, and letting them know that you're open to partnerships, and letting them take the lead on the work, on the grant writing, on the heavy lifting, with the hope that then you will get a cut of that grant funding, is another strategy we've seen work well too.
All right, thank you. So looks like we have time for just one more question. And the question is, what suggestions would you give to schools who are in the beginning stages of developing their comprehensive school mental health framework as it relates to funding and partnering with the local community?
Go ahead, Alex, you first.
Oh yeah, I would say just really starting with what you have and really understanding your assets and understanding, you know, what programs are in place, you know, what resources do you have, and really getting a strong grasp on that, and then aligning that with what the data tells you about where the student needs are, and start having that as a starting point for the conversation, and really grounded in that information, and recognizing that you don't have to do everything at once, that you can start with where those greatest needs are and where the programming and work that you're doing in your district is not meeting those needs, and engaging around those opportunities with community-based partners that might be able to help meet some of those needs.
Yep, and kind of following up on that, Alex, looking at it in a little bit of an additional way, it's almost thinking of like a strategic plan. I guess maybe it's kind of fresh on my mind. We just did our district strategic plan. So part of that process involves getting together with all the stakeholders, you know, parents, community members, teachers, kids, administrators, as we crafted our district strategic plan for the upcoming, you know, 5-year cycle. If you're looking to start with, you know, specifically a mental health thread and whatnot, like, who are your community partners? Like Alex said, invite them, those stakeholders, to the table. Like, for example, in Woodbury, there's the Evergreen Avenue Family Success Center, which didn't exist 10 years ago, which now is a thriving support agency for students and families with English as a second language, right? We talked earlier about Woodbury's community changing over. So that new community support was created. So they were invited into our most recent strategic planning session. Again, they didn't exist as an agency 10 years ago. So work with, you know, staff members that have been in your district for many years and find out, like, who's in your community, what are the agencies, what are the, you know, whether they're counseling agencies, whether they're social service agencies, you know, whatever, and invite them in, see what they can do. You know, you might not have an agency that would take Medicaid students, but you might have one that says, hey, we can partner with you, and if any of your kids are, you know, take AmeriHealth insurance or you know, Blue Cross Blue Shield, and, you know, we can service them. And you might be the type of district where more of your population, you know, fits that demographic. So do the research of who's in your community and get them involved in the planning. They might give you answers you don't even know that you had.
Wonderful. Thank you again to both of you. I know that I'm feeling inspired to do some more research on funding and write some grants. So I'll pass it over to Kati to close us out.
Thank you, Stuart. And also a big thank you to our presenters this afternoon. Thank you for providing us with a wonderful wealth of information on this topic that's so important to our school districts in New Jersey. On your screen, you'll see our slide containing our evaluation information. As mentioned before, our network is funded through SAMHSA, and as part of receiving this funding, we are required to submit data related to the quality of this event. So if you do have your mobile device, you can hover over the QR code, or you can also access our webinar survey, our evaluation survey, by clicking the link on that Stuart or Alicia will provide in the chat box, or I will also email everyone after this session a link to our survey. Next slide, please. I also would like to mention that we do have a podcast as part of our provider wellness initiative, and it's called, it's titled Toward Wellness and Recovery, and it's our podcast channel as part of the Flourishing at Work series. You can access this podcast by either accessing it through Spotify, Apple Music, or Podbean. Next slide, please. And then our contact information is also on this slide if you'd like to request any more materials after this webinar. Just as a reminder, you will receive a certificate of completion within 7 days, as well as a link to access the Zoom recording and the slides that will be posted on our website. And I will email everyone a link to our evaluation survey. And this concludes session 7 of our webinar. We hope that you will join us at our final 2 webinar sessions in the next 2 months. And again, we just want to thank you. We thank you for your time, and we hope you have a wonderful rest of your day. Thank you all.